Hi everyone, good to see you again. Today is lecture number 2. We talked about the counselor's identity by comparing other helping professionals last week. And today we will talk about history and standard of counseling profession. I listed 4 different objectives for today. The first one is identify influence of related helping profession on counseling. We will talk about 3 major the field that influenced on counseling. The first one is social work, psychology. The last one is psychiatry. The second one is explain briefly history of counseling profession. So the first 2 objectives are related with the history of counseling. And the later other 2 objective was designed to understand the credentials and standard of counseling profession. We want to understand the code of ethics in counseling and some ethical, hot ethical issues in counseling. And the last, we want to compare credentialing of counseling between United States and Korea. I wonder how you are interested in being a counselor, so that information will help you to understand how you can be a counselor. So the first one, the influence of related profession, we wanted to talk about 3 different influences on counseling. The first one is social work, psychology, and psychiatry. The social work is more the system-oriented and comprehensive approach. So that really impact on the counseling. That's why now the counseling is pretty network system. And counselor try to provide not only specific helping service, but also some other related services as well. And also psychology is more theoretical oriented perspective, but it also gave lots of theoretical foundation. And psychiatry is also related with diagnosis. If you look at the this slide, it will show the influence in more detail. The psychiatry started first here, and psychology and counseling and social work. So it started, each field started in different times, and each one focused on different area. For example, psychiatry is more related with medical approach. So psychiatrists work on the hospital and medical setting. Psychology is more theoretical based. They have lots of experiment on the lab. And social work, they are working in the field. So they work in many different settings, and usually they work in the community setting. And counseling work in different settings as well. So they are work in hospital and lab and community. So they are different in the beginning of the history. But as time goes on, it's about 160 years. As time goes on, it kind of work together, and they are going in one direction. So now, if you look at right now, it's pretty work together, and they share lots of things. They share lots of theoretical foundation. They also share some practice and training as well. And also in the real field setting, they try to work together. It's more collaborative relationship among them. So you see a kind of pattern in the influence of related profession on counseling. If we look at the next slide, it shows each field influence on counseling. The social work is, as I said, is system-oriented. They try to look at a situation not only individualistically. they try to look at our client and the environment more systemic perspective. They also stress the field experience. So if we want to be a social worker, they have to have lots of working hours in internship and practicum at their field setting. And also social work stress the advocacy. Advocacy is more proactive approach. It's more preventive approach. Before something happens, they try to support with comprehensive intervention. For example, let's think about a student who is showing low academic achievement. If we want to help the student, there are many different ways. But let's think about this particular case with low academic achievement and also low socioeconomic status, which means a very poor area and poor community and violent area types of thing, for example. So if we want to help the client in this situation, as a social work, they try to change not only the client himself or herself, but also try to change the whole system. So they try to develop a certain peer mentoring program or mentoring program with the senior student. So try to provide more support for that student. They also try to help some other additional service for the people who live in the low social economic status area. So it's more comprehensive approach to the counseling. And psychology is also comprehensive approach to therapy, which means the psychology developed so many different theories. In particular, counseling psychology area, there are many different theories. I mentioned that about 400 different theories in counseling, but right now we will talk about 4 major theories. For example, psychoanalytic and humanistic and behavioral and cognitive. Even these 4 different major theories see a person from very different perspective, and that really provided a conceptual framework to the counseling. And psychology also related many different research methodology. So it elaborated the result of the counseling. And also counseling skill. The counseling psychologists, they developed so many different micro-counseling skill. We will talk about later, for example, how to reflect a client's feeling, how to paraphrase what the client said, how to interpret, how to confront, how to ask a question, how to summarize. All different types of counseling skills were developed in the counseling psychologist area, counseling psychology area. So that is the second area that influenced on the counseling. The third one, psychiatry, it's related with medical approach. So they focus on diagnosis. So they develop kind of diagnostic manual that helps psychiatry to diagnose and prescribe for the student who need help. So that they are related psychopharmacology. So they prescribe medication, and also based on the development of medical equipment, we came to know many disorders are related with their internal and organic and inheritance. So if you look at 3 different major influences on counseling, it will help you to understand the counseling from more broader perspective. So we are talking about the history of counseling. The first perspective, we want to compare some other influence on counseling. And now we want to look at some internal changes in counseling. So I like the phrase here by Toynbee, without knowing where we have been, it's difficult to know where we are going. That's why we want to know the history of counseling. If we know the pathway we went through, and that will give us some insight for the better future. So I just categorized on 3 different periods. The first one is 1800. It's about, the 200 years ago, there was a social reform movement. So the social worker and psychiatrists and psychology, even educator, they try to provide enhanced service. There was a kind of whole movement in this area. The counseling is one of them. And by the industrial revolution, lots of industry required, and they were seeking many jobs in the field. And that was, it's called the guidance movement. And also in the psychology field, the lab science developed so many different testing, for example, intelligence. And also in this period, the Sigmund Freud developed the psychoanalysis approach. So that was the first and initial foundation in counseling. And in 1900 to 1950, we had the first guidance counselor at the school setting. It was initiated in the United States, in Boston, by Frank Parsons. And he was the person who initiated the guidance counselor. Is pretty similar to the school counselor right now in Boston area. And also by the World War I, they used and they developed much more testing for screening soldiers. So expanded testing movement as well, and spread of psychotherapy. It was only the Freudian psychodynamic or analytic approach, but in this period, Carl Rogers and some other related the person emerged in this area, for example, Williamson. And after that, the third period in the counseling history is lots of different counseling theories. And for example, guidance counselor, so many different, from elementary to middle and high school, much more school counselors are working right now. And also diversification, more theories, and more counseling profession. We talked about the different counseling profession within counseling profession. Do you remember that? They are working in school and college and rehabilitation service and gerontological service. So we see more diverse and sophisticated counseling service. And even recent change, I would say probably multicultural approach in counseling is one of the major changes in counseling right now. So we see that in 200 years ago, there was a kind of initial movement in psychology, and then they expanded a little bit in the middle, and now we see lots of diversity in counseling. If I add a little bit about the Korean history, 1945 we were liberated from Japanese colony, and after that we adopted the American education system. So after liberation from Japan, we had the first guidance counselor as well, even in Korea. So we had about 50 or 60 years of counseling history. And also, not only the guidance counselor, it's called 교도교사 a long time ago. and it became a school counselor right now. It's called 전문 상담교사 in Korea. That is the school counseling field, and at the same time, the counseling psychologist and other professional counselors began to work in different setting, even college and some community and many other different settings right now. So, this is the history of the Western society, and we, Korea, studied the counseling profession around this point. Okay. So we talked about the history from two different perspectives. The next one, we want to know some standard in counseling. I wanted to introduce ACA's ethical standard. ACA means American Counseling Association. This is the acronym of American Counseling Association. This is the major body of the counseling profession in United States. It's one of the most developed professional body, and they developed ethical standard. It is important because the code of ethics summarized the whole profession's value and their ethic and also morality and some other related issue in counseling. I uploaded ACF Code of Ethics as a manual, so you can take a look at the whole. The brochure is about 20 pages. I just summarized here from A to H. The first one is the counseling relationship. It explains what would be the good counseling relationship between counselor and client. Do you remember the therapeutic alliance as one of the characteristics of effective counselor? So they're explaining the counseling relationship. The second one is confidentiality. Privileged communication is a little bit legal term, and privacy is more casual term. So the confidentiality is one of the most important concepts in counseling, which means we want to and we have to keep what the client said be secret. And lots of information in the manual about the confidentiality. Professional responsibility. We have to provide a good service to the client. As a counselor, it explains what would be our responsibility as a professional. Do you remember the competence as one of the characteristics of the good counselor at the lecture number 1? And the relationships with other professionals. I explained that counselors are now working together with other helping professionals, social worker, psychologist, psychiatrist, and some other related helping professionals as well. So it explains in this role. Evaluation, assessment, and interpretation. When we see a client, the first stage, we try to make a good therapeutic relationship, and after that, we usually try to evaluate the origins of the problem, and we try to use lots of assessment. So it explains some evaluation methodology as well. And supervision, training, and teaching. Supervision is a kind of relationship with higher level of professional. For example, when I was in master level program, I did my practicum at the school. I had my supervisor who was licensed and certified school counselor who gave me kind of teaching and instruction and giving me more counseling skill. So I was a supervisee and she was a supervisor. So she helped me to be better counselor. And also that is related to the training and teaching. So the Code of Ethics explain this related some training issue. Research and publication and resolving ethical issues. So the ACA Code of Ethics suggests and also describe many issues around these topics. So I recommend you take a look at the ACA Code of Ethics. You can download on the website. And I put down some ethical and hot issues from the ACA Code of Ethics. The first one is confidentiality. I mentioned that confidentiality is something that we want to keep what the client said be secret. But is it absolute? Do we have to keep secret all the time? What do you think about? Not really. There are some exceptional cases. For example, if we know our client tried to harm themselves, for example, make a suicide. If we know the client tried to harm others, if they are planning to kill someone else, we have to break confidentiality. So there are some exceptional cases. The second one is competence. Am I good enough? Which means when we work as a counselor, we are seeing so many different the client. For example, if we are seeing a student who has an eating disorder, we have to think about, okay, I know what the eating disorder, they have some problem eating and related issue. But we have to think about, am I good enough to help the person who has an eating disorder? Do I have enough knowledge? Did I have enough training to help this kind of client? Am I knowledgeable to that? If I'm not, I am responsible to help this client from different way. I would refer this client to other professional who can help that client much better. So this is another issue. We don't want to help all the client. We have to think about, we have to make judgment when we see a client. That is a competence issue. And dual relationship. Do I have non-professional relationship? Which means we want to have a therapeutic relationship with the client. So that was the important the area in counseling. But if we see a client in different setting, that really impact on our counseling relationship. That is called a dual relationship. We want to make a single therapeutic relationship with client. If we make a dual relationship, for example, we see a client in the counseling office every week as a counselor and as a client. And if we see the same client in different setting, in a cafeteria, in different setting, and that will impact on our counseling relationship. So that is another big issue in counseling. So we want to see a client in more therapeutic relationship. We don't want to make a personal relationship with the client. The last one is transmission of value. Do you remember one of the characteristics of counselor is open-mindedness? I explained sometimes teacher had a tendency to put the teacher's value on client. So that is one characteristic we want to avoid as a counselor. So these are some hot issues in an ethical situation in counseling. The last slide is showing some credentialing, some qualification for counselor. Our textbook explains some credentialing for counselor in the United States, and I added some information from Korean perspective. In United States, there are three different level of certification. The first one is the National Certified Counselor. It's called NCC. It is a certification for the counselor. If you want to be certified NCC, you have to have at least master's degree, and you have to take a test. It's called NCE, National Certified Exam. You have to pass that exam, and you have to show a certain amount of supervision hours. So if you submit all the paperwork, and they will review, they will look at your test score, and they will issue certification, National Certified Counselor. It's pretty broad. Lots of national certified counselors are working right now. And the next one is a state level, state certification. I put down one of the examples as a school counselor. If you want to work as a school counselor in the United States, you have to be certified by state. And it's interesting because each state has a different criteria. For example, when I work at the Pennsylvania, they require 48 semester hours in master level. It was the same as in South Carolina, but it was different in New York State. So each state has different criteria for the state certification, but you have to have a certification if you want to work as a school counselor in United States. It also requires master level and the qualification. The last one is state license, is license of professional counselor. I could say it's called LPC. It's the most higher level of certification in counseling right now. So based on this national certification, they require additional supervision hours and additional field experience. So I could say LPC is the highest level of certification right now in United States. So if you want to work as a counselor in private setting by yourself, you may want to have LPC. So these are the certification in the United States, and here is the our certification in Korea. I put down two different levels. The first one is national certification for counselor. The first one is 전문 상담교사. It's a school counselor right now. The Department of Education in Korea hired 전문 상담교사 from 2005. We have about more than 100 school counselors in Seoul right now. They're working. They're same level as like a regular teacher in school. Another national certification is 청소년 상담사 by 보건복지가족부. That's another type of certification. The next one is professional association certification. It's professional association is a 학회 in Korean. They also have their own certification as well. So 전문 상담사 is a Korean counseling association, and 상담심리사 is a Korean counseling psychology association. Has different. These are two major professional organizations in Korea, and each organization has their own certification. So compared to other professions, for example, if you want to be a teacher, usually require undergraduate degree. But in counseling, usually it requires master level, so a little bit advanced the qualification compared to other professions. It's same as the social worker. Social worker usually undergraduate program, but counseling is a little bit higher qualification. Right now, one of the trend in Korea is even undergraduate level. They made lots of undergraduate level counseling program. So we now see some counselor who had only bachelor degree. that is the reality. Okay, so today we talked about two different issues. The first one is the history of counseling. We talked about some major three different areas influence counseling: social work, and psychology, and psychiatry. And we also looked at some internal changes in counseling. And also we talked about the counseling profession standard. We reviewed the Code of Ethics in American Counseling Association. We also talked about some ethical hot issues. And finally, we reviewed some credentialing by comparing United States and Korea. Okay, so next week, we will go into the counseling theory itself. So we will talk about some different theories in counseling.